Hello students, we're going to talk about public insurance and there are 7 different types of public insurance that you see listed on the screen, and we're really going to spend this little time together talking about the top 3 because the top 3, Medicare, Medicaid, and CHIP, really cover more people in those 3 groups than out of all 7. So let's go ahead and jump into this. Let's talk about Medicare. Medicare, to be eligible for Medicare, you have to be in one of 3 groups. You have to be 65 or older, or you have to be someone who is not elderly but is disabled and covered under SSI benefits, which is Social Security Insurance benefits. Or you could be someone who is at end-stage renal disease and be eligible for Medicare. So, but typically the largest group is going to be the first one you see there, people who are considered elderly and over age 65. There are 4 different parts to Medicare that you need to know about. Part A covers any type of hospital services. So if you are someone under Medicare, say for example your grandparents are on Medicare and they go to the emergency room and subsequently they end up being hospitalized, then that's going to be covered under Part A. Part B is going to be anything where someone who is on Medicare goes to a doctor or some type of a provider that is under outpatient services. So just if you get a sore throat or you've broken an ankle or something like that and you go to see a doctor, that's going to be Part B. Part C is really your it's Medicare Advantage, which is a managed care organization that Medicare recipients can enroll into so that they can have some enhanced coverages. And so a lot of Medicare recipients choose to do that. So things like Humana or United Healthcare, they offer a lot of times, and several others will offer a Medicare managed care plan, and that's Part C. Part D covers all the prescriptions for a Medicare recipient. All right. So how is it paid for? Where does Medicare get its money to be able to provide this insurance? It comes from 2 places. One, from our payroll taxes. So every time you get your payroll check, for those of you that have jobs or have worked in the past, you'll see taxes coming out, and that goes to pay for federal entitlement programs, which one of those we're talking about now is Medicare. And the other one is anyone who's enrolled in Medicare. There are certain premiums that they pay. We talked about all those different insurance terms, and so this is one of those that we talked about. So they pay those on a monthly basis. Medicare is not free, which a lot of people seem to think that it is, and so that's how it's paid for. The second one we're going to talk about is Medicaid. Medicaid is a program that's there for folks who are considered indigent or poor, and you have to qualify at a state level, which is what is means tested. So you'll see that bolded in red there. So you have to qualify based on how much money, how much income you have coming in for your household. So for me, for a family of 4, there's going to be a specific amount that I would have to qualify for if I was filling out a Medicaid application. This is a federal entitlement program, but it's paid for or financed by federal and state funds. So let's move over to this slide. Let's talk specifically about Alabama. And so you can see that I just grabbed this straight off of the Alabama Medicaid website, and so there is a link right here. So if you were to click this in your slideshow, it would take you straight to the page that kind of shows you the poverty level limits, meaning how much money can a person, they can't have any more than this money listed here on this slide to be able to be eligible for Medicaid. So for example, if you're a family of 1, so a lot of you guys, you're independent now, living out on your own, and this shows that you cannot make more than $1,478 in a month, which if you multiply that times 12 months, that means that you could not make more than $17,736 to be eligible for Medicaid. So that's not a whole lot of money at all, but it just shows you how poor you have to be eligible for Medicaid. For a family of 4, it's $3,054 a month, which kind of, if you multiply that out times 12, that comes out to about $36,000 and some change. So just kind of gives you an idea. The last program we're going to talk about is CHIP, which is the Children's Health Insurance Program. It came out in 1997 as part of the Balanced Budget Act, and this piece of legislation came out because there were still so many kids that didn't have any health insurance because their families just were not poor enough to qualify for Medicaid. And so this is, again, administered by the states, and it is a federal insurance program.